1.
Yeah, 50. I would say just 57 and a half would be correct. So doctor, what are we doing here?
Checking the anal glands
Okay.
for his size.
And how are they looking?
The right anal gland is empty. That's all what came out from. And now the left anal gland, which is empty as well.
So that's great.
Yeah, that's great. That means doesn't need any flush. It's flushing by itself easily.
That's good.
Yeah,
Yeah.
nothing coming. Okay, let's see about
The prostate itself.
if we can reach it, because my fingers are limited in terms of length. And he's a big boy.
We will now proceed to use our state-of-the-art ultrasound machine to examine the prostate of this
So
canine.
here we have the prostate.
Right.
As far as I can see, it's a matter of issues with homogeneity of the tissue. You can see two kind of colors in there. Brighter one, which is in there and in there, with some dark parts. But in here look like a cyst. In here look like a cyst into his prostate. That's a better appearance, and that's the reason I wasn't able to feel anything wrong with my finger, because the rear end caudal area of the prostate seems to be normal,
So it could be easily missed, this.
with no
Ultrasound.
Ultrasound, yes.
And he's got a cyst there, right?
Looks like a cyst, yeah. And let's see the other side. A bit more gel.
So we're able to do all his x-rays and immediately jump straight onto his ultrasound. So while he's under general anesthesia, all of these things can be done. His nails will be clipped. All of these things will be done for him.
Marker.
Right, okay, so we are ready to take the first x-ray. Okay.
Both holes are pretty symmetrically. The position of the pelvis isn't a perfect one, it's a bit curved,
You're
right? Yeah, so that means shall be very straight, but it's very straight in terms with the spine, which
Sure.
is good. Yeah, we can assess properly the femoral heads, and as you can see, we're speaking about a pretty big gap in between the femoral head in here
Absolutely.
and the acetabular edge, yeah, the cavity which is into the pelvic bone in here, where the femoris shall go perfectly in to be able to have a good joint. Yeah?
Sure.
Okay, it's pretty similar in here, but as you can see, here it's a bit less, but in here, that white line shall go and come down to cover all that cavity. That means in here we are speaking about a certain stage of hip dysplasia, but he's
Older.
9 years old.
Yeah.
So
But
he went
again,
through
this
his
would be a
life-
reservoir of pain, right?
Yeah, yeah.
Right.
Any kind of hip dysplasia is coming with a certain level of pain. Okay, in terms of his knee joints are looking fine. Here, that whiter area, and in here, that whiter area are the patellar bones, yeah, which are in pretty good position. and also the gap in between femoris and tibia is pretty equal. We can't see any white spots in here suggesting any kind of osteophytes, which are part of the osteoarthritis degeneration process, which is coming with pain as well. So the only issue with him is his right hip. And
Because they say he does struggle to get up.
yeah.
So that's wonderful that
but
we picked that up.
can be correlated with some changes in terms of his lumbar spine as well.
Right.
We'll take the lumbar spine pictures now, because we're speaking about 2 pictures each side.
Sure.
And another VD1 or DV will be much
Perfect.
easier.
What was the measurement of the prostate, sir?
The prostate was 1 centimeter, 0.93, with the cyst about 0.5 centimeter.
And I would like to speak to you later about what a normal prostate size should be. So we're just having a look at this X-rays. Yeah. So this is the spine.
Yes, it is. Yeah.
These health MOTs are so important. Vitto has been very upset and reactive, and his personality's changed completely. He has some pain, and we're going to help him manage the pain.
Upper right, which is 100 arcade. We're speaking just about a minor level of tartar. The lower jaw
Is that canine that looks...
is pretty similar on back mouth, but
This
as you can
canine,
see,
wow.
the canine already
Wow.
got a
Wow.
start building tartar in between gum and tooth.
So, and then that's very interesting. Until opening this veterinary practice, the importance of dental care wasn't such a strong understanding or strong belief. But it's really, really important. What we see when we open dogs' mouths is shocking. And it's actually become incredibly personal for me, because I had a tooth extraction, a molar. I don't like dentists on a good day. And the pain that was causing me was unbearable. I was unproductive. I couldn't even function properly. And I had a choice. Because our dogs can't make their own choices, it is the most prudent and loving exercise to make sure that you get a dental health check for your dogs at some point. Trust me.
But it's a certain level of inflammatory response in here. It's just a mild level of gingivitis. The teeth are looking very good for his age. Very good, but still he's got quite some tartar in there, which we'll start cleaning it now.
And he's doing very well under his general. Nice and stable.
Yeah, lovely and stable. It's actually quite free, but
2, 3, yeah.
yeah.
Well, I'll just have a little polish up now after the scale. And good boy. So Vitto's in theatre now for his castration.
So when we're looking at the size of the testicles, this is an animal that's been under chemical castration.
Yeah, as you can see, the testicle size are not accordingly with the dog size, are pretty tiny testicles.
I've never been a fan of chemical castrations. There are so many side effects, with chemical castration. You have urinary incontinence, behavioral changes in many dogs. The hormone can create lethargy, depression, anxiety. They can become a little bit more reactive. But in this dog's particular case, of course, once you've used the ultrasound to establish a prostatic disease, castration is a very sensible and appropriate approach. Many prostatic cysts, benign prostatic hyperplasia, are testosterone driven. Neutering significantly reduces testosterone, and which typically causes the prostate to shrink. Having to remove a prostate is a very invasive surgery, and while he is under anesthesia, it was a prudent and sensible action to castrate him.
We have Vitto. We talk about, he started reacting at people, because he's in pain.
He has been licking me.
Yeah, I'm telling you, it's unbelievable. It's so important, these health MOTs. Oh, I'm so happy for you, mate. Everybody would be upset, if you've got reservoirs of pain and you can't tell anybody. Look at your tail, son.
Let's test him. Look what I have.
Of course, we all do.
Come on. No.
He's so open. Good lad. Bravo, 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 bravo.
Good boy. Look.
Okay, wicked.
Now
Look at the expression in your eye.
You're
Good
a giant
lad.
softie, actually.
Good lad.
Giant softie.
So Vitto is feeling happier. And we're just walking him round, introducing him to the rabbits. And he's loving farm life. Let me see the expression on Vitto's face. Good boy, Vitto. Good boy. Good boy. Good lad. Yeah, he's going to have his pain relief. I've got to say that I feel that he definitely is appearing to be in less pain. He's moving well. Yeah, you're seeing some rabbits here. Good lad. Good lad.
It's nice to have a wonderful recovery area for the canines. My client is always the dog. Vitto's owners have been personal friends of ours for 9 years plus. But I would like to say something on the human front. Prostate disease in men. You really, really want to make sure that you are doing PSA blood tests, especially if you are, a black male in your 40s and 50s. It would be a lunacy for you not to do the tests. We picked this up with Vitto, and hopefully our actions will improve, his quality of life. He's already looking happier. That's what it's all about. Health MOTs. Humans and dogs, don't sleep on it.
Please feel free to call the Noah's Ark team for any type of support that you might need. We have a state-of-the-art facility set in 55 acres. We also have paddocks that clients can use for running their dogs. And due to our historic ability to handle the more powerful working dogs, we specialize in that aspect.